All right, thanks, John. October is Breast Cancer Awareness Month. 1 in 8 women will develop the disease in their lifetime. The median age for diagnosis is around 62 years old, but one young woman in Metro Detroit got the news 3 decades earlier than that. Our Alicia Smith shares her inspiring story in today's Living a Better Life.
Amanda Hoffbauer of Farmington Hills was only 32 when she made a disturbing discovery.
I was lotioning after a shower and I felt a lump and immediately panicked.
Her OB told her it was most likely a cyst that would go away. But after a month, she asked to have a mammogram. That was followed by a biopsy. On March 5th, 2018, Amanda was told that she had stage 2 breast cancer. She embarked on a series of tests to make sure she was ready for chemo. When she got the news, it was stage 4.
The bone scan showed that it had actually metastasized into my bones. So it was in my spine, my pelvis, my hips, everywhere. I was just thinking, you know, my life had just started. I had just started this relationship. I had been with him for 7 months at diagnosis. So I was worried about that falling apart just because this was a journey that was going to be for the rest of my life. Like I was going to be in treatment for the rest of my life.
She had no family history and tested negative for every single gene mutation, including BRCA. She sought out a second opinion with Dr. Michael Simon.
I think some of this.
He's the leader of the breast cancer multidisciplinary team at Karmanos Cancer Institute and professor at Wayne State University's School of Medicine.
Having cancer isn't necessarily a death sentence, you know, and even at any stage of cancer, there's hope. There are treatment options. There are clinical trials where we're looking for new treatments.
Under his care, in April of 2018, Amanda started aggressively treating her cancer. She underwent chemotherapy, a lumpectomy, and 30 rounds of radiation. Her boyfriend Adam was by her side through it all. He popped the question on Valentine's Day of this year, and they're planning to get married in September of 2020. Amanda's most recent scans are clear, and she's prepared to get checkups every 6 months. Her message to other young women?
If something doesn't feel right in your body, you have to advocate for yourself. You have to do it.
Monthly self-breast exams are so important. Thanks to Amanda for sharing her story. The American Cancer Society says women 40 to 44 should have the option to begin annual mammograms. Women 45 to 54 should have annual mammograms, and women 55 and older can transition to mammograms every other year. But the exception to all of that is if there is a family history, then you need to consult with your doctor about starting mammography sooner. Also, if you have dense breast, additional screening may be necessary. Bottom line, make sure you talk with your healthcare provider about your breast health. I'm Alicia Smith, 7 Action News.
What an inspiration. We wish Amanda